Hello, it's Bruce Williams, and today I'd like to present Part 5 of my series on gross pathology of non-human primates. And today we're going to talk about the respiratory system. As I do at the beginning of all of my lectures, I want to thank my colleagues and friends who have provided me images either directly or through some great online resources, like the Primate Pathology Image Database run by Dr. Ann Lewis of the Oregon National Regional Primate Center. Okay. Our first image shows the incised and open air sac in a baboon. Air sacs are laryngeal diverticula, which are seen in a number of species of New World monkeys, such as howlers and siamangs, and also Old World monkeys and great apes like orangutans as well. The purpose of the air sac is not really known in primates. There are a lot of theories. Some say that it allows the call of certain species like howler monkeys, which can call over 5 miles, to be more resonant. Other people say that it serves as a reservoir for air and oxygen when they're making these prolonged calls. Nobody really knows what they do, but we do know that they can be a significant source of disease in animals that possess them. Here are infected air sacs in a baboon. You can see the fibrinosuppurative exudate, and the problem is that these connect through a very thin tube to the larynx, and there is no ventral drainage. So these can become infected and be a real mess. Work by Dr. Rita McManamon, a pathologist at the University of Georgia during her time at Zoo Atlanta, showed that the majority of these are due to Klebsiella pneumoniae, and we're going to talk about that later as a significant pathogen of the respiratory tract. But you can see a wide range of bacteria within them as well, including staph and strep and coliforms, and they're a real mess because they don't drain. They can serve as a source of exudate, which is coughed up and aspirated, resulting in a suppurative pneumonia as well. This is a fairly old picture of a disease that used to be a real problem in primate colonies, but we don't see it very much anymore. And this shows the diffuse necrohemorrhagic interstitial pneumonia, which is associated with measles infection. And I will remind you once again that most of the diseases of non-human primates are those of captivity. And it used to be a real problem before people were vaccinated for measles. This is due to the rubeola virus, a morbillivirus, of which humans are the reservoir. And the classic disease of morbilliviruses, including neurologic disease, interstitial pneumonia, and rash, is what's seen in Old World primates or macaques. When we talk about measles in New World monkeys, it's a very different disease in which fatal gastroenteritis is usually the problem. Measles virus is a highly contagious virus which is spread by aerosols from handlers to the captive non-human primates, and it does not occur in their natural habitat, so they really have no protection against it. In macaques, there is a wide range of symptoms which we're going to see in multiple systems as we go through this lecture series. Infected colonies often display a 100% seroconversion rate, and there are a number of subclinical infections, so it's not going to be 100% morbidity or 100% mortality. In the lung, the lesion is that of an acute diffuse bronchointerstitial pneumonia, with airway lesions being the primary finding. As we see in other morbillivirus infections, you'll have necrosis of airway epithelium and the presence of multinucleate syncytia in various components of the lung, including the airway epithelium, occasionally in pneumocytes, and within alveolar macrophages. And you can often find intracytoplasmic viral inclusions, which are prominent and composed of viral protein. Viral replication occurs in the nucleus. Affected animals may display a range of other signs, including a rash, fever, leukopenia, conjunctivitis, and about 40% of animals will display white spots within the mouth, which are known as Koplik spots. Giant cells may be seen in the lung, in the rash on the skin, in the lymph nodes, where they are known as Warthin-Finkeldy cells, and occasionally in the central nervous system. Some animals may show central nervous system in the absence of any other findings. Here's a picture from Dr. Srini Rao, which shows an African green monkey with marked conjunctivitis and a suppurative rhinitis. African green monkeys are one of the species which are often wild caught, especially in some of the islands of the West Indies, which they were transported to during the slave trade up to 200 years ago, and in which wild colonies flourish. They're one of the few non-human primates that are still wild caught and transported and are susceptible to a condition which I think is very similar to shipping fever. While I might have 6 different agents of shipping fever in cattle, in non-human primates, it usually boils down to a single one, and that is Klebsiella pneumonia. The cases that you see of Klebsiella pneumonia are the worst pneumonias generally that you see, and the animals will have a history of being caught and shipped within anywhere up to 3 months previously. Klebsiella pneumonia not only affects the lungs in these animals, but you tend to have a rather profound sepsis, and you may find the organism and whatever associated inflammation. It could be suppurative, it could be very little at all due to the mucoid capsule that is produced by Klebsiella. In more acute cases, you tend to have less inflammation. You can also see upper respiratory infections, rhinitis, and middle ear infections. This can be also a common cause of mortality in young Aotus monkeys and chimpanzees, without the added immunosuppressive effects of shipping, quarantine, and overcrowding that we see with it in the African greens. So we said before, you can have bacteria anywhere. So meningitis, cystitis, septic abortion, peritonitis, all of these have been identified in animals affected with Klebsiella pneumonia. Here's another case of Klebsiella pneumonia, which to me sort of resembles the worst kind of pneumonia that you'll see in pigs. It's Actinobacillus pleuropneumoniae. In this particular case, we do have fibrin on the surface of the lungs. The lungs are diffusely inflated, edematous, and we have areas of hemorrhage and necrosis, probably infarction. So it doesn't get any worse than this and in non-human primates, and I generally tend to think about Klebsiella at the top of the list. I know that this is a lecture of Gorss Path, but it does warrant showing you what these foci look like. You can see areas that are clear of the bacteria, some that have the bacteria, some that have gotten to the point that there is tremendous influx of inflammatory cells, and you have lost the septal architecture or septic necrosis. And as we get a little closer, you'll see that there are tremendous numbers of extracellular bacteria. And if we got really, really close, we would see that each of these is surrounded and separated from each other. They have very loosely arranged colonies as a result of the mucoid capsule that the organism produces, which helps it escape the inflammatory protection of the body and go throughout the body itself. Now, if that wasn't bad enough, within the last 10 years, there has been a new hypermucoviscoid strain, which has been identified in people and in African green monkeys in outbreaks in several laboratory animal facilities within the United States as well. And of course, PCR helps to identify these particularly pathogenic strains, but a quick and easy way to identify them is to grow them up in the laboratory and then put your probe into the colony. They're generally fairly mucousy anyhow, but if you can draw a string of mucus up to half a centimeter, this is considered a presumptive test for this particular strain. The other thing that's seen with this strain is it concentrates on forming abscesses of the lymph nodes and within the abdomen. So the pathogenesis is a little different as well. So this is the hypermucoviscous strain of Klebsiella pneumoniae. Well, here's a pet monkey, a little marmoset that has extensive fibrinous polyserositis. Also, there is a pneumonia here. And whenever you see tremendous amounts of fibrin, I want you to think in any species, just for a minute, you'll hear me say this a lot, of Streptococcus. Like gram-negatives who possess endotoxins that cause damage to endothelial cells, streptococci, the particularly virulent forms, often have exotoxins, which will act in a similar fashion, damaging endothelial cells, resulting in leakage of fibrinogen, which will polymerize in the extracellular space, and you often get a lot of fibrin. This animal had a concomitant E. coli infection, which might have worsened the vasculitis if it got into the systemic circulation. But the primary culture in this particular case was strep pneumoniae. Here's an older picture, also of strep pneumoniae, which at that time was probably called Diplococcus pneumoniae. And you can see the tremendous amount of fibrin that results from infection with this agent. You will also see it in other potential spaces, including the pericardial sac, the meninges, and the joints. Here's something that is totally going to ruin your day, often an unexpected finding when it's seen, but we should always be on the lookout for this, as well as we are on the lookout for herpes B, or vaccine herpes virus 1, when we're dealing with macaques. Especially in macaques and rhesus monkeys, tuberculosis tends to be a rapidly progressive, fatal disease characterized by the early and widespread dissemination of granulomatous or pyogranulomatous lesions, primarily within the lungs, but you can see them in any organs, especially within lymph nodes. Another disease of captivity, and so the handlers, or the people who capture these animals, need to be tested for the presence of tuberculosis before you trust them with your macaques. Here's an older lesion of caseating necrosis, or caseating granulomas are those which have a thin sheen of mineral to them. They tend to mineralize, and the term caseous is derived from the Latin meaning cheese, so they have this sort of cheesy exudate when you incise them. They can become so firm and large that in opposition to the airways, they may even result in asphyxia. We see similar lesions in sheep and goats with a bacterium that acts very similar to this, and that's Corynebacterium pseudotuberculosis. Tuberculosis in macaques is most often seen as a result of infection by Mycobacterium tuberculosis, the same agent that causes it in humans, but rarely can be the result of Mycobacterium bovis. And when we talk about Mycobacterium avium, and there are many species now that comprise that group, That is not referred to as tuberculosis. That's referred to as mycobacteriosis. It's a type 2 rather than type 1 hypersensitivity response, and lesions look very different, and we will eventually cover that in primates as well. Mycobacterium can be a very tricky disease from time to time because not all of the areas of infection will resemble traditional granulomas. In areas in proximity to the airways and to the pleura where you have a slightly higher oxygen tension, you may get lesions that have a liquid center, and you would think on gross inspection that these are abscesses. Unfortunately, when you come back and find out that they are mycobacterial granulomas, that's not a happy finding. This disease also bears the use of having a nice histolesion here because it is extremely characteristic. You want to identify your cases as early as possible, and this is a classic tuberculosis granuloma. The granuloma has like most granulomas, has a central area of cellular debris, which is surrounded by small numbers of neutrophils and then epithelioid macrophages, many of which have combined to form syncytia in the form of foreign body giant cells, and these very characteristic Langhans type giant cells, which have the nuclei arrayed in a C or sometimes even a full circle around the edge of that enlarged macrophage giant cell. Around the final edge of these granulomas, you'll have various combinations of epithelioid macrophages, lymphocytes, plasma cells, fibroblasts, and collagen. And nothing else, especially with the presence of the Langhans giant cells, resembles this in non-human primates. Another condition seen primarily in wild-caught macaques is infection with pneumoniae semicoli, the lung mite of non-human primates. The exact life cycle of this parasite is unknown. Transmission is usually by direct contact. Because they are susceptible to ivermectin, seeing the live mite is fairly uncommon these days, but you may encounter changes in the lung which are associated with dead and mineralized mites. It's thought that the life cycle is completed in the lungs because you can find all stages of pneumoniasis, adults, eggs, and larvae, in the lungs of affected animal. Here's an absolutely wonderful picture that shows the somewhat raised, hollow, golden granulomas scattered throughout all the lungs, concentrated in the areas of the large airways, which are in the caudodorsal lungs in affected animals. You can also see that there is pigmentation of the hilar lymph nodes. The pigmentation is the result of the excretion of mite pigment. Mite will live on tissue fluids and blood, and they will break down that material and pass it as sort of a black pigment, and it will be ingested by macrophages, and the appearance over time goes from sort of a clear translucent wall to a golden brownish color, very characteristic. Here's a formalin-fixed specimen, an old picture from the Walter Reed Army Institute of Research, and somebody, for reasons unknown, decided they liked a red background. I think a red background is absolutely terrible for photography, so that's my word of advice. Pick your color carefully. You can never go wrong with black. Everything tends to show up very nicely. But here's that formalin-fixed specimen from the caudodorsal lobes, and you can see that the airways have been hollowed out by the presence of the mite, by the presence of the granulomatous inflammatory response to their pigment, and you have sort of a lysis of the elastin and an expansion of these airways to what is known as mite houses. Surrounding that, you'll see some smooth muscle hyperplasia in these bronchiectatic airways. You can imagine that occasionally, due to those remodeling changes of the airways, you may get large bulla formation if they're close to the surface, and occasionally these may rupture, resulting in pneumothorax. With the exception of the occasional pneumothorax, these mites are generally tolerated very well and are usually seen as incidental findings in animals at necropsy. Histologically, the mites will be present in these airways. Here is a large mite, and the remainder of the airway is filled almost to the point of occlusion by granulomatous inflammation, which incorporates all of this mite pigment, and you can see some lymphocytes and plasma cells, and these will be scattered through the lungs. This is an adult mite. You can see an ovary here. Here's part of another one right here. You can just see the legs, and they're typical arthropods with a chitinous skeleton, jointed appendages, and little strips of skeletal muscle, especially in the vicinity of the legs. We'll finish up with just some neoplasms, and you can see any type of neoplasm metastasized to the lungs. In macaques, you can see metastatic carcinoma as a result of metastasis of intestinal adenocarcinoma, or in this case, cervical carcinoma. And when we get to the reproductive system, we'll talk about rhesus papillomavirus type 1, very similar to that seen in humans that causes cervical carcinoma. Well, that's our brief coverage, brief at least for me, coming in a little over 20 minutes, of respiratory disease in non-human primates. I hope you've enjoyed the lecture, and I look forward to our next lecture, which will be on the hematopoietic system of non-human primates. Thank you and have a great day.